The mission of Gibson Area Hospital and Health Services is to provide personalized professional healthcare services to the residents of the communities they serve. Here today, sponsoring our segment and to give you some tips on how to keep your heart healthy is Carrie Kirby. Welcome to ciLiving.
Hi, thank you for having me.
All right, so can you tell me a little bit about Gibson?
Gibson Area Hospital is a small critical access hospital where we have grown over the years to be able to provide so many different services, and we're really excited to be here to share some things that we do, especially for cardiology.
And I was going to say, you mentioned cardiology. February is Heart Month, so tell me a little bit about you.
I'm a nurse practitioner at the cardiology clinic with Dr. Rajaguru. I've been at the cardiology clinic for a little over 2 years now, but I've been at Gibson Hospital for almost 20. And I was a hospitalist nurse practitioner and then transitioned into the outpatient clinic world about 2.5 years ago. So
wonderful. And tell me a little bit about some things that I can do personally to keep my heart healthy. Should I be eating a certain way? Should I be exercising? Should I not be exercising? Please say not.
Well, unfortunately, you're going to have to exercise. Sorry about that. So most importantly, heart disease is the #1 cause of death in the United States.
Oh, I didn't know that.
Yes, yes, and especially for women. So the most important things you can do are things that you can do at home every day. By exercising, we recommend 150 minutes of exercise a week, which sounds like a lot when you say it like that, but it's really only 3 or 4 days a week, about 30 to 40 minutes.
Okay.
You want to do that consistently and get your heart rate up and keep your heart healthy. Eating healthy, it's very simple. You don't have to do any fad diets. It's just lean proteins, a lot of fruit and vegetables, whole grains, healthy fats and oils like avocado, olive oil. The Mediterranean diet is actually the diet that is recommended by the American Heart Association, and that's a really easy diet to follow.
Yeah, I see this graphic here of what's on the plate. So I see some greens, I see some fruits, I see some grains. Is that?
Grains, yeah. And then, like I said, healthy fats and lean meats, fish, chicken. It's not a diet per se. It's just
it's a way of life.
It's a way of life.
It's a way
of
eating.
Thank you. Yes,
yeah,
yes.
Absolutely.
And then, of course, exercising and avoiding smoking, maintaining a healthy weight, moderation on your alcohol intake. Those are all very important to protect your heart. And if you have other comorbidities that increase your risk, like sleep apnea or other disordered breathing or diabetes or high blood pressure, managing those diseases as well with your physician to help decrease your risk of developing heart disease.
So if I don't have heart disease and I don't have other comorbidities, do I need to be getting an EKG? Do I need to be doing any preventative testing? Sort of what does that look like for your heart?
For your heart, you want to look at your family history as well. That carries a very strong indication of your risk of heart disease. So if you have a family history, your parents, your siblings, even your uncles and grandparents that have maybe had heart attacks in the past or have had open heart surgeries or had to go in and have their hearts procedures done to open up arteries in their heart, then you are already at a higher risk.
Okay. So
it's definitely something you want to talk to your provider about. There are EKGs you can do for screening. There's also a test that we can do called a CT calcium score. That will measure about the presence of the disease in your coronary arteries or the arteries around your heart, and tell you if you're a low, moderate, or high risk for developing that later. Yeah.
And I was going to say, speaking of arteries, I see you brought me a toy.
I did.
A tool in your world. So what, I imagine this is an artery.
Yes. So this is a cross-cut of an artery, and this is what we would be looking for on the CT calcium score that I was just talking about. What it's looking for is this yellow is representing what we call plaques or calcifications that are built up in the arteries.
Okay.
And the CT will show us if you're at a small risk or a high risk, and the more you can see on your CAT scan, the higher risk you are of having problems.
Okay, and then this, I know, comes off so we can look at the crosscut at the inside of the heart.
So this is the different chambers of your heart. You have the atrium on top and the ventricles on the bottom. And a different type of heart disease that doesn't have to do with your blood vessels, but more of the structure of your heart is what we look for when we're looking at ventricles and arteries. And we look at those tests with echocardiograms or ultrasounds of the heart.
And those are non-invasive procedures,
correct? Non-invasive, yes. That's all imaging done through the radiology or x-ray department.
So if you're afraid of needles, you can still get your heart checked.
Yes, absolutely. Yes, absolutely.
Well, thank you so much for this information and for being here and sponsoring our segment today.
Well, thank you for having me. I appreciate it.
And if you want more information, you can visit us on the web after the show at ciLiving.tv.